The count for the dead and injured in Israel and Gaza is only mounting. But these are not just numbers, and it's important for us to remind ourselves about this. Hospitals are flooded with patients and medical teams are working round the clock. We are being joined by Professor Roy Kessous, the Deputy General Manager of Soroka Medical Center right now. Thank you very much, Doctor, for joining us. These are very, very tough times for you and for your entire team. Even as you are treating patients victims of a full-blown war, give us a sense of what you are seeing in your hospitals.
So it's been a horrific, let's say, 5 days. In the past 5 days, really horrific. The numbers of wounded patients that were arriving to our hospital are unimaginable in Israel. We're talking around over 850 wounded casualties, civilians, most of them civilians, children, women.
Doctor, are most of the people who are being brought to your hospital, are they civilians? What's the state in your hospital?
Yes. Not most. I would say around between 500 to 550 patients or wounded patients were civilians, and around 300 were soldiers.
Doctor, I have to ask you this. As you and your team go about doing your job inside the hospitals, just how challenging is it for all of you in these current circumstances? Are your hospitals well equipped? Do you have enough hospitals there?
We have enough hospitals. We are currently in a steady situation, ready to receive more patients. You asked about how I manage myself, or we manage ourselves. I assume it's similar to other physicians and medical staff, nurses, and etc. It's a split. It's truly a split. So I will describe my story. My eldest son is in the army. His name is Ori. He's fighting. I hope he's safe. I haven't heard from him 2 or 3 days. My wife and kids are stuck abroad, so they couldn't come back home. So in a way, I don't know if I'm happy or not, but they're not here. And we hear about friends, family that are missing.
Doctor, this just seems to be a very long-drawn war, far-fetching consequences. How are the hospitals, medical teams there preparing for what may be some very difficult days ahead?
The first measure is to, in a way, dilute the number of patients that we have here by transferring some of the patients, some of the wounded, to other medical centers that are in the center of Israel. We are getting supplies constantly, so we are making sure that we have enough supplies to at least take care of another surge or 2 episodes of mass casualties that are going to come. Our medical staff, now we've transferred them to a state of resting a bit, because we fear that if they continue the same pace, they will not be able to continue. So we're trying to, because in the first few days, nurses, doctors, medical aides, they refused to go home. They insisted on staying here in the hospital, continue to treat the patients. And we had to force them to go home, take a few hours sleep, take a shower, and come back.
Absolutely extremely difficult and challenging days these must have been, Doctor. But I have to also ask you this. Have you received patients who are not Israelis, who are not locals, from other countries, maybe from even Gaza?
Those that we received, of course, we treated them the same way we treat we don't differentiate. We received foreign civilians that were visiting the area. We even received an agriculture worker that came from the Gaza Strip. He came from Gaza. He worked in one of the fields. He was injured by a bomb. We are treating him the same way. No differences. We're medical professionals. When you work, you don't discriminate. an island of sanity. This is how we do it. We don't think.